songwriter for years. They've been a backup singer for years.
Hey, Mo.
Right, exactly. Yeah.
Hey,
Dr. Finn.
welcome. Happy Hump Day. Happy Wellness Wednesday. Happy Woosah Wednesday. Whatever you call it, we are glad to see
I like that.
you.
Yeah. Happy Winter Wednesday. It's winter all over the country, right?
Only for another 32 days. I'm counting down, honey.
I know, I hear you. It's
Mhm.
rough out there in a lot of places, though.
32 days.
But we're so glad you guys are here, and we have such a great show today, such a great story to share, and I hope it stimulates some more stories. So if you guys have the same story, we need to hear from you. Kind of write to us in the chat, because we think this is more common than we know right at the moment. But our show today is about breast cancer and prostate cancer in the same house.
And uterus.
On mute, Mo.
Thank you. And uterine cancer as well. We have to talk about this. You know, I practice in a service area, and that's the region where I work, where 1 in 4 people who live in this area have a potentially hereditary cancer, meaning there's a possible gene mutation that could have got passed down, and breast is included, prostate cancer, uterine cancer. And we know the majority of cancers are not from hereditary mutations, but when we hear families that have multiple cancers, we want to talk about what we can do for wellness, for prevention, for detection, because right now during COVID, the screening guidelines are a little bit all over the place. We were just talking before the show started about the Society of Breast Imaging, which has now made a recommendation, not a guideline, but a recommendation that women who are considering getting their mammogram, but who have also gotten their COVID-19 vaccine, should wait 4 to 6 weeks later to get their mammogram. And the reason why is because they're saying the lymph nodes could be enlarged. And Dr. Crawford, I'm gonna let you take over and tell us a little bit about this and why and how it should impact screening. And then let's talk about prostate cancer screening as well during this last year.
Yeah. So thank you again. I wanted to really thank you again for the opportunity to speak, and always then say hello to a new family member, the Burdens, and this beautiful family, and allow them the courage to come out and talk to us about their story.
Yes.
So the point is, from the immunology background, if you think about the vaccine is different than the conventional vaccines in the past, where you would produce an immune response that had a wide variety of molecules that attack. In this case, you have an immune response that's more targeted. So it's almost like having a single dart and continually able to throw the dart and hit the bullseye. So this is this new generation of vaccines called mRNA vaccines. Now what happens is this: since the inflammation, everything is targeted and more focused, that means the power and the efficiency, which everyone is seeing, 94, 95% efficiency with these vaccines. So with that efficiency, once it's injected and they're doing what they call intramuscular injection, where the needle goes down past the superficial, the skin itself, and into the muscle, you get this inflammatory response, this big burst of immune activity. And these cells, and primarily what I worked on as a thesis as a graduate student, is the dendritic cell. And the way you think of this cell, it's like an octopus or a mop, and it just spends its time pulling together trash, debris, foreign objects. Then it takes this information or vaccine or dead cells or bacteria and traffics it to your regional, what they call regional lymph nodes. So for women who had breast cancer, you heard about the cancer has moved to your lymph nodes, or they're looking and doing a physical exam to see if they can feel your lymph nodes. The same concept holds true, is the immune cells now with the vaccine will then move to the regional lymph node. But what's happening is that the inflammation that's generated from the virus is so powerful, then you get these swollen lymph nodes. And now, how does that cross over the cancer? The question is I don't know if the swollen lymph nodes are related to the vaccine, or is it related to cancer? So they want you to take the time to let the inflammation go down. Now, if you get vaccinated on the left side and you feel it on the right side, and that's a different story.
Mm-hmm.
But there are anomalies that take place where sometimes stuff goes on the other side, the vaccine. But normally, that's what's happening. And so when your doctor talks to you about, well, maybe we need to hold off after the vaccine, what they're asking you to do is just wait for the lymph nodes and the inflammation in the lymph nodes to kind of settle down and relax a little bit.
Thank you for sharing that. It is challenging though, because the messaging around screening has been really confusing. You know, a year ago, we were telling people there's something going on and you might want to hold off on your appointments. And, you know, as March and April and May, we turned people away from screening. And now we're asking them, come back, come back. And now we're saying, well, wait. Mm-hmm. And so I think it's a really nuanced conversation, and people need to talk with their doctors and communicate, because the imaging centers, especially for breast, are really, they're getting behind in their imaging. We're seeing delayed appointments, and if you have something that's found, delayed callbacks, and that's a real source of anxiety for patients. So I think that it certainly calls into question, you know, how we're screening and who's getting screening, and there's some process improvements that we can probably make in this process, you know?
Yeah. Wow. Well, so we have this lovely couple here today, David and Grace Burton, and they have an amazing story. And just even looking at some of the numbers, you know, prostate cancer for Black men is kind of equivalent to triple negative breast cancer for Black women, right? The mortality rates and the incidence rates, and it's just, you know, a bad scene for Black men. And prostate cancer, wouldn't you consider it a preventable cancer, you guys, to a degree? Like, I mean, you know, at least you can get that PSA test and have some degree of warning about it.
This is tricky.
Yeah.
I'll look to Dr. Crawford.
Yeah.
Please. No,
Well,
I'd love to hear from you, Ms. Burton.
Well, my experience is the availability to actually get the testing is vast, but the privacy and the just the intimacy of even finding out it's just not something that, at least in my upbringing, you don't want to do it.
Yeah. Well, tell us your story, David. Tell us your story.
Well, my story basically is I don't like doctors. I don't like going to the hospital. You know, if I can avoid, if I get cut or whatever, hey, I'll give me some alcohol peroxide or A&D ointment or something. My dad was a pharmacist, and my whole attitude was take care of yourself. You know, if you have to go to the doctor. But anyway, over time, as I got older, I was changing jobs, and the insurance that was supposed to be transferred to me, there was a year, well, it was like an 8-month time frame where I couldn't go because my insurance wasn't up to date with this particular company. So I waited about a year to do my regular general testing, and of course, within that year, the doctor found prostate cancer, and then I went for a biopsy, and it was confirmed. I went back for a second opinion, and it was, you know, double confirmed. And I was completely embarrassed. Like, okay, like, what do I do? Is my wife going to leave me? You know, that was the first thing in my mind. Like, if, you know, because I didn't know what the result was going to be with functionality or anything. So,
David, had you had a PSA test before you got diagnosed? Like, and how old were you?
No, I didn't have a PSA test. I had a doctor who was quite intuitive, and he felt that the prostate was just large. And then, of course, that translated into me getting a PSA test, thus biopsy, thus.
And how old were you then?
46.
So when did you get your first PSA test, guys?
Like I said, maybe 2003 or something like that.
No,
And
no, Dr. Keith, like what's the standard for when you should get one? I'm just curious.
So we put together a grid called Fin PSA, and we took in it. We went through the United States Preventive Medicine Task Force guidelines, national the NCCN guidelines, the AUA guidelines, and family practice guidelines. And we put the chart together. When I put the chart together, and this is something that Fin has been advocating since 2012. Age 40.
Age 40. All right. So you had not had one before then. Okay, cool.
No.
All right, go ahead,
Yes,
Dan.
but the question is, did anyone talk to you about this age 40? When was the first time somebody talked about prostate to you? Was that 46?
absolutely, yeah. Where it became, critical that I actually get testing. Yeah, it was around like 45. Actually, it was at 45. I remember.
So there's two. So let me clarify. If you are an African American man, African ancestry man, Afro-Caribbean man,
Afro-Caribbean. Yeah.
okay, I'm putting everybody in the group.
Mm.
You are at high risk of developing prostate cancer, 1 in 6. But guess what? If you're in another group, family history, you're at a higher risk. So what we're doing and what Ricky's doing on her end with breast and what we're doing on our end, we're trying to educate not only the patients, but the physicians.
Yes.
You see, somebody was supposed to tell you at 40, we need to start screening. Now, do you have a family history of prostate cancer?
My dad, yeah.
So your dad, that's the first, what we call first generation.
Right.
That's somebody you can touch.
Right.
That automatically says you move from a 1 in 6 to a 1 in 5.
Right.
And the
And
issue
you didn't know that. And you didn't know that before.
didn't know it at
Oh,
all.
I didn't know that, but also, this is a hard head. I don't want to.
But here's the deal: is I don't want to go on that one because that was my grandmama used to say. but I won't use that one.
And you black men do not want to go to the doctor.
You don't want to go. I said, yeah.
It's all right. Hard head makes a soft,
behind.
That's right. I knew where you were going with that.
I'm sorry, I had a flashback. I was just like, ooh, no, we're not talking about that. Okay, but what I wanted to say was, you get comfortable once you understand more about it. Everybody's afraid. And so if something new comes up, COVID, we have the ability to fight this disease, just like we have ability to fight breast cancer. So we don't, Ricky brought up a point, and the difference is and it's not really a difference because we're all in the same boat. It's awareness and being able to screen early. And then at least we're maybe a couple of years ahead of the breast cancer groups, because we got to get Black women in their 20s, educating them about breast cancer. And then maybe Ricky can kind of highlight what we're doing with some HBCUs like Prairie View A&M. Sorry about that, but I had to mention that. But yes,
absolutely.
The standpoint of educating, awareness. Why I wanted to ask a quick question. I brought up, you slipped in functionality, so I know what functionality code word means.
Well, let him tell his story first. Let him tell his story first and then go there. We're not going to talk about sex yet. Okay.
Okay. Well, fast forward.
We have to talk about it. We must talk.
We will talk about it. Yeah, but let him tell her story, because you got to hear this, you guys. It's like, it will blow you away.
Okay. Fast forward. I learned about my diagnosis, and I wouldn't tell Grace because, she got diagnosed 2 days before me in the same week in 2010. So she tells me, oh, well, honey, sit down, I have uterine cancer. And then I held on and I said, don't say anything. Let her just flush out what she's telling me. And also I wanted to digest what the impact of this was. And then, of course, 2 days later, 2 days later, she gets the call about breast cancer.
Mm-hmm.
So the first thing I thought was, okay, how do I keep my thing quiet? But we have two girls, my girls, and there was so much crying in the home and
We
whatever.
all cuddled,
And and then,
huddled together. And I told them the story and they started crying. And then he chimed in. And I was surprised.
Yeah.
The girls were double surprised.
yeah. So,
uterine cancer, breast cancer, and prostate
Prostate
cancer
cancer.
within 4 days. To what? 4
right.
days? Oh my God.
So I had to tell them, okay, get your helmet on, and I got something to share. And then there was we had to deal with that. Then the next steps were, okay, well, who's going to get surgery first?
I did.
So
I did. And that was very, very hard. I never had any kind of surgery in my life. That was the very first one. My sister stayed with me for a week, and then because he went also to get his surgery done and stayed with him for a week. So she was here taking care of us for 2 weeks, cooking, cleaning, and it was the hardest thing ever.
How
I
long
never.
ago was it?
Mhm.
what's
How long
that?
was it? How long ago? How many years ago?
Oh, this is 2010.
2010.
Yeah.
2010.
Yeah.
Yeah.
And your girls were how old?
20 and 18.
Yeah.
Yeah, 20 and 18.
Must have been really scary for them too. Gosh,
Yeah.
right?
Yeah.
Yeah.
And I did research, when I was told I had to go speak to the oncologist. I took my sister with me because, I get nervous and forget about everything. And I asked my dad, because my mom's been gone 26 years. So I asked my dad, and he said, no, he didn't know anyone in the family who has cancer. But after I had mine, I had a cousin who I found out through Facebook, and she had breast cancer. But no one before that I know of.
Mm.
My parents didn't know anyone either. Of course, I didn't ask my mom. My dad was the only one I could ask. But I did ask an aunt of mine from my mother's side, and she said no. Yeah. The only thing that runs in that family, in my mom's family, is heart attacks,
High blood pressure.
high blood pressure, hypertension, and they all died of the same thing.
Can I ask you a question? Did anyone from talk to you about breast cancer from your physicians or your doctors or your care providers?
Well, I went religiously every year to get my 1 year physical done. And, there's a requirement, that you have to get, the breast, examination. I was very reluctant when I was younger. And I didn't start doing that till I was like in my 40s.
Mm-hmm.
I had heard about it when I was younger. But my 23 years at work, I went religiously to the doctor. They did say that I had to have it done. Sometimes I went, sometimes I didn't.
Mm-hmm.
This one time that I went, they did the examination, and they said, oh, we have to do it again.
Was the mammogram?
Yeah.
Okay.
So they did it again, and then they said, no, we have to do it again.
Mm.
So, and then they said, I'm sorry we have to do this, but there's something there and we don't know what it is.
Mhm.
So then they kind of pinpointed it, and it was in a milk duct, one cancer cell in a milk duct. And it was very painful, The biopsy was very painful as well.
Yeah.
Because they didn't take the breast off. They just did the one surgery, they went in there with the thing and they sucked it out, you know, the biopsy. And then when I had the surgery, they marked it. They did want me to take a pill for 5 years, like a radiation or something.
Like tamoxifen or something like that.
The
Estrogen
oncologist
blocking.
kept
Mhm.
coming to me when I had this done, and I refused.
Tell us why.
Yeah.
Because they said that that it would turn black, and I said to them, so doesn't that mean that they're killing the breast and they got to cut it off eventually? They said, yeah, it's gonna die. We have to cut it off. You know, so I said, why should I do that?
A doctor
This,
said
this
that?
is radiation, right? You're
About
saying that
four or five doctors,
yeah.
including the oncologist, said they were pushing me to sign to take a pill for 5 years. And they said that I was going to get a reaction from it and that it was going to get dark. And I was like, it's going to get dark. But to me, dark means there's something wrong with your skin. You know, your skin doesn't turn dark like that, you know. And I said, well, is it going to go back to normal? They said, no, it's not. So I said, well, that means that it's going to kill my breasts and I'm not, you know, going to have anything there. So why should I take it? So they were very pushy.
So let me ask you a question.
Mhm.
Just a sidebar for a quick. Did they use the term clinical trial?
No,
Hmm.
they just wanted me to take this.
Well, what does that mean? Like, what do you mean?
So here's what I think is happening. I think that no one explained very well to you the
No.
process that something treats your breast and something will treat your whole body, right? So surgery will remove a lump, it'll get rid of cancer. And then what we do after surgery in order to keep it from coming back again is we do what's called radiation. It's x-rays, external beams, like getting a chest x-ray or getting a suntan. And
Mhm.
that can turn your skin darker. It can turn,
Right.
especially,
They
you know,
didn't
it can
offer me
cause some radiation that
radiation
can
or
change
chemo.
color.
They
And
offered me a
then
pill. Mhm.
and then the estrogen blocking pill treats your whole body because if estrogen is a growth factor for your type of breast cancer, if that's what's helping it to grow, then the thought is, well, let's take away the thing your cancer needs to grow. And so they offer you a pill to block your estrogen. That estrogen blocking pill should not turn anything black in particular. It can cause some menopausal type symptoms where you have hot flashes and sometimes vaginal dryness. Some people get joint aches. But it sounds like there were some gaps in the explanations to you about the different therapies that you needed. And, you know, we find that when doctors spend more time with patients and explain things better, you know, Dr. Crawford, when you explain a clinical trial or chemotherapy to a patient, they're 23 to 25% more likely to consider those therapies just because the doctor sat down and spent a little bit of extra time with it. And so, you know, we can't expect compliance to be high when we don't understand what's being offered to us.
And then I had a question also. And then after your procedure, did you take any medicines?
I took Levinox shots because of for the blood clots.
Mhm.
And I took that for like 3 months, and then they put me on a medication to thin my blood out. That I took and I am on it still.
Hmm. And no other treatment for your cancer.
Well, to tell you the truth, I never went back. Never.
Wow.
You
I
had
was
the
too
surgery and you never went back.
traumatized
Sounds like that
between
relationship
both.
wasn't a good one.
Yeah, yeah.
And I've never gone back because I was traumatized. The uterine operation was terrible. I never felt anything like that before. I literally felt like I was going to die. And the breast was from the biopsy when they put those things inside, you know, to suck it out. I nearly fell off because they lift you up and they put your breast and you have to lay down and then they suck it out, you know, and I nearly fell off that bed. She was nice to me, the nurse. She held my hand. She said, breathe, it's gonna hurt. And so since I moved and I jerked, they had to do it again. So I suffered twice, traumatized. I've never been back to the doctor.
Are you going to the doctor now? Just
Yes,
your
I
annual
am.
checkups?
Yes, I am. I had complications. I have a lot of complications. I had diabetes, high blood pressure, asthma. I developed anxiety last March because of the COVID, losing my job, and that was very, very hard. And yeah, so
Well, to really
Wow.
thank you for
All right.
sharing that with us. That's it.
So go back to the cancer for a second, because this is a lot. God bless you. God bless you, both of you. So you had your surgery, then David, you had your surgery. So now you guys are back home in your house, trying to recover from this whole trauma. And so now, David, talk to me about all the emotions that went around having your cancer.
Oh,
Or do you want to talk about it, Grace?
Hey, well, it's very, very layered in the sense that it's a little bit. Well, one part that was kind of funny was when we're home before her sister got here. It was the day before she was able to get here. So if a fork or a spoon or something dropped on the floor, we kind of like this looked at each other, and because we couldn't bend down and pick it up, it was just too much pain. So it was just like, well, somebody will get it. And the girls were out. They anyway, that was a funny part. But the other emotional part that was, really terrifying for me is losing her, because, I was married before, and although we've been together all this time, my daughters, I raised them since they were, full time, full custody, since they were 9 and 11. So just losing her, I didn't think much about myself. I was just wondering where all this was going to go and how it was going to impact my daughters. And then the healing process started to accelerate, and the doctors told me, well, you have to get radiation. I did get radiation. I'm going to fast forward my story, but I got radiation.
You can keep it slow.
Oh, okay. Well, throughout the radiation, everything was fine, and things, started. They said my PSA wasn't rising. You're doing good, but radiation for me caused radiation cystitis. So it's like clots that come up in your private area. And so when you go to urine, sometimes these remnants from the radiation, these blood clots will come up, and it blocks your bladder from being able to pee. And it was a whole bunch of stuff dealing with that. And then I've learned a process how to get through that. The doctors tell me, doctor at the time, oh, you need to do chemo. So I was pretty angry with the whole experience, because I was never like, doctor, I'm sorry, I don't have my glasses on, but the doctor that was speaking with the glasses, I'm sorry.
Okay.
She was.
Oh.
No, her.
Dr. Mo.
Oh, okay. So I don't have glasses.
She was saying how
I had glasses on.
Yeah, the quality of communication, wasn't there. And the doctor's just demanding that I get chemo. And I said, no, I'm not going to do chemo. Why should I do chemo? Like, well, give me some facts, give me some data, give me some graphs, give me something. Mm-hmm. Oh, this is the #1 killer in Black men, and you should do it. That's how he spoke to me. And I said, well, I'm not doing it. I'll take my chances. And the reason why I was so adamant is because I lost my brother. He had lung cancer. He was in the Navy, and he went through a lot of chemo, and he didn't make it. And I just thought in my mind, I'm not going to do that. So I stuck I stuck to my guns. I'm okay. It's been, 10 years later. And So that's where I am now. So
And your father had it. And your father had it though.
yeah, my father had it, and he had already passed away after I got cancer.
So I wanted to bring up just a sidebar just for both of you. This is an excellent time for us to even talk, because it seems as if you guys were just fighting this fight by yourself.
Totally.
Yeah, we
Now,
don't really know
we
anybody.
want to let you know you got friends. You got people. We're talking about, I'm not talking about, maybe you can call. I'm talking about you can call, you can text. If you have a question, because your journey has been shifted, and to a certain extent, you're kind of, you know, not riding blind, but you don't know where you can go. And
Right.
so now, breast, prostate, cancer in general, we can guide you and better explain why you need to have chemo. Okay. And there's one thing I want to tell you. To me, you were diagnosed early, because luckily,
You were so blessed to be diagnosed.
luckily that transition and they were having you test. Here's a fact. The 5-year survival for men. So can I ask you a question? Was your cancer localized to the prostate? Meaning, was
Yes.
it did metastasize?
No.
Okay. And both of you think about both.
If this helps, the Gleason score was 8.5.
8.5 is a high risk, but guess what? It did metastasize.
No.
What we see is this, and what we know. This is not me quoting it. CDC, okay? NCI. Everyone is in agreement, because the data that's come out, the 5-year survival for men who are diagnosed early, 100%. The 10-year survival, 100%. So you're in that group. And so now you're venturing forward into the next decade of your life. And so if something happens, you're not alone, because now, from the standpoint of breast and from the standpoint of prostate, there are tools. And because we have to be able to educate you about clinical trials, because these new clinical trials for breast and for prostate, then think about this. One, you're going to get the cutting edge technology, the best that's out there. So don't believe that, oh, they're going to give me placebo and so it's a sugar pill. No. At the best case, at the worst case scenario, you get the standard of care, but it's not even the standard of care if you look at it, because when you're in a clinical trial, it's almost like concierge medicine.
Yeah, I've heard of, yeah, that's true. Yeah.
And then you got cutting edge, then you got people who are going to take the time
To explain it.
to explain everything. It's a long document, I'm just letting you know, but they will take the time and explain it, and they wanted you to be successful. And then the last is like no cost. And depending on your age group, it's no cost. So we want you to, from my perspective, and I know from Ricky's perspective, is it was a blessing for us to meet you, and we want to be part of that journey moving forward to help. I tell everybody, write out or map out your life in pencil, because you're going to erase. So you're going to map out your prostate breast journey in pencil, because you're going to erase, because these new cutting edge technologies are going to be coming out. And especially since we're talking about some genetics involved.
Yeah, I know. Did you guys have genetic testing?
I didn't know.
And no one asked you about that?
And let's look at it in the lens of 2010, right? So in 2010, I think that we all agree the medical community could have done a much, much better job of offering genetic testing to Black and brown people. And we are really still just getting caught up. I submitted an abstract to ASCO yesterday that where we are just getting caught up on the types of research that we need to be offering Black and brown people that wasn't offered back in 2010 when you were diagnosed. So Dr. Crawford, I wonder if you could comment on the possibility of trials for patients who are this far out from their diagnosis and from their treatment. There are still opportunities to participate in clinical trials.
Okay. So the first thing I want to tell you is that I wanted to compliment you on this point about how far back, because back as early, we talked about 2004, we were talking about BRCA genes.
0304, BRCA1 and 2, yeah, BRCA1.
Right. And then you have reports back in 2009 talking about the lack of Black involvement in Black and African American or Black folks' involvement in clinical trials, as well as genetic testing.
Yeah.
And so that wasn't the point that you bring up. We can help, because Ricky and I, we can look and find out clinical trials. But right now, there is a clinical trial right now that specifically wants to test men who have prostate cancer or history of prostate cancer.
Yeah.
And this is a matter of fact, it's a Janssen clinical trial. So I can send you the information.
Okay.
I just wrote up the patient summary for it. So,
I got genetic testing in 2011. Now it's a different, I had another panel done a year ago that was totally different and much more comprehensive. But it would seem like a doctor would have recommended it to them, especially because, they're in the same house and David's father had it. And
you got to take.
It seemed like somebody would have at least given you the opportunity to engage on that conversation.
You would think that. But BRCA1 and 2, BRCA1 was discovered back in 1995, right? Marie Claire King. And so by 2010, the testing was being offered to some people. Insurance was not covering it across the board. The criteria for who should get it was a lot more stringent, and it was an afterthought. Whereas now genetic testing helps us to even determine what surgery we might do. We may consider more aggressive surgeries. We may consider certain chemotherapy regimens. We may tailor whole treatment based on the genome and based on the hereditary cancer makeup. So it's a lot different, and there are registries even now. I know Myriad Genetics is offering a registry for patients who met criteria but weren't offered genetic testing. And so there's still an opportunity for that as well. But back then, 2010, the doctors, it wasn't on the radar like it should have been. I got tested in 2011 also, and did the update testing with so many more genes, And
I'm pretty sure I paid for it in 2011. I had to pay for it in 2011.
Yeah, pay for out of pocket, right?
Yeah.
And Myriad Genetics published something back in 2009 that stated that 15% of African American were BRCA positive, 15.9%. So it's not like, oh, we just discovered this. It was all about education. These are the hurdles that took place, the lack of communication, effective communication to the patient, because some reports are just the doctors weren't even communicating. Even if you had insurance, they still didn't communicate this area to you.
It's true. And, one of the people in our comments has said, the medical community hasn't really earned the trust for the participation in clinical trials and such. We're still trying to explain and make sure that we adequately understand our diagnosis and our treatment. And to offer things on top of that, when the communication is not there, is an extra layer of confusion and an unwillingness to participate in those things. When you talk at people long enough, they're going to stop listening to you. And it sounds like, the Burtons are a key example of that very thing.
Yeah.
And then what I wanted to bring up, something that Ricky was talking about, is this is what, so think about it. At one time, breast cancer, we talking about uterine cancer as a bucket by itself. Then we talk about breast cancer as a bucket by itself. Then we talk about prostate cancer as a bucket by itself. And then we're talking about lung cancer. These are all the cancers that we heard, right? But the thread that weaves throughout the cancers is genetics. That's why Ricky was bringing up, and Dr. Mo were bringing up this whole concept of importance in being with the need to test. Because
Knowing
now,
her story, knowing her story, knowing his story, knowing where you came from. Gosh, you guys,
May
so
I ask you guys
for your daughters too,
that's for your daughters.
Yep.
Because it said, because David, for your daughters, you have to test. Don't look at it as if it was prostate cancer. Well, they don't have prostates. I said, no. But if you
have BRCA, they could get it.
They could get it. They're at higher incidence, and then they should be tested.
And it's a saliva or blood test. But may I ask you guys what your relationships are like with doctors now, today? Has all of that colored your interaction and your willingness to consider things like COVID vaccines and, you know, and other things? What's it like now for you?
My head went from hard to soft. So I'm a lot more, yeah, so I'm a lot more flexible working with doctors, providing they don't, well, I'm a lot more flexible. I just want information not to be data dumped on me, rather explained. And so I'm a lot more open to, visiting my doctor if something does come up, to taking the action, to make the appointment, follow through, and to not wait.
Why? What changed your mind?
She did. She just kept saying, you got to go. If something comes up, you got to go. And I got tired of telling me I have to go. So, no, but also that I'm being funny, but realistically, what really made me change my attitude was, legacy and life expectancy, and really being responsible, not just for myself, but my family.
Mm-hmm.
Okay, can I ask you a question? Are we talking about across the board? Are we talking about with your primary care provider? And do you have an
Across the board?
Okay, so do you have a urologist or oncologist?
I don't have an oncologist now, no.
A urologist?
Yes.
Okay.
And you get your PSA checked.
Right, yes.
And
Are
you're
you
getting
on
your
any-
breast done.
Are you on any hormone therapy or anti-androgen therapy? Did they try to put you
No.
on a hormone blocker?
No, the only thing I wanted to reduce was the effects, which I still experience, of the radiation cystitis, which haven't been, which hasn't been solved. So periodically I suffer from that, and I came up with my own remedies to heal myself.
So prostate, and I don't know a lot about prostate, so help me out, Dr. The prostate, the effects stay with you, I mean, like for life, right? I mean.
Yep.
And so I wanted to ask you a question. How often are you testing your PSA?
Because of every 6 months.
Every 6 months. Okay, that's
Yeah.
good. And then what is your PSA level now?
I think 0.3 or something like that. It's not high at all, and it's not expanding.
Not moving, right?
It's not moving out.
Right. And you're getting your breast checks. How often, Grace?
Well, I just started this year.
You just started.
Actually, I started last year because I needed my high blood pressure also affected my heart. I had an ablation done last year, February. And I've been going back to the doctor. I mean, I usually go back. I have a primary. I just, I lost my job and retired. So my insurance has changed. Had a lot of anxiety behind that as well, because I was, I'm on insulin and countless other, medications. I have different doctors with my old insurance, which now I have to look for that they do not cover. So insurance plays a lot in, yeah, I'm seeing the difference when you work. They offer you good insurance. I had a good insurance, Anthem, and they covered everything. And now I have Metro Health Plus, and their primary hospital is Queens. I don't necessarily like that hospital, and I'm not allowed to go back to the hospital that was treating my ablation. So now I have to go look for new doctors with this insurance. Medications are not all covered, so I just had to change my insulin, daytime and nighttime, to another version that the insurance can cover. You know, so it's a
Grace, I know 2 Black breast cancer surgeons in Queens, 2 Black female breast surgeons. I'm going to try to connect you with them, because I think one of the 2 should be able to take your insurance. One might be at Montefiore, and the other I think is in Queens. And I want you to see them. And I want you also, we got to look at some nutritional counseling and nutritional support for you and for both of you. Because has anyone talked to you guys about your nutrition and ways to improve your wellness through nutrition and reduce your risk for cancer?
No, I've never had that offered. I did, they did tell me to see a doctor, for a dietitian because of the diabetes, and my numbers are high. And I try to control it as best as I can. I changed my way of eating. You know, I'm Latin. I cooked a lot of Spanish food, and a lot of that has changed. I can't eat the rice that I love. I eat a lot of beans now, and the meats. I've suffered different things with the illnesses that I have, and one of them is I don't like meat that much anymore, so I don't eat much of it. Most of the protein that I get is from the beans, and when I crave meat, I'll have the chicken or the beef or whatever. It's not often. And then when he got diagnosed with diabetes this last year, he got diagnosed. I totally changed even more because I want him to be healthy. So despite all of my illnesses, I have to take care of him as well. Make sure that he eats well, and he takes his medication.
Okay.
You guys are so precious. You guys are so precious.
One thing I wanted to highlight, I wanted to bring to everybody's attention, in how important wives are, or the chief medical officer of the family. I just wanted to let you know, you're the chief medical officer. Okay.
That's right. I agree.
She's doing her job.
Yeah.
I have to. He's very hard headed, and
It's getting softer, but
it's getting softer. But he fights me on a lot of little things, and I tell him, and he gets little attitude or whatever, and I just keep telling him, and then I have to put my foot down, and I said, "This is the way you have to do it, and you have to listen to me because I've had." Diabetes longer than he has. And I know, so when he gives himself a shot, it is the wrong way, that he does it, but he wants to do it his own way. So, I have to teach him how to do it.
She's a good teacher.
The right way, but I have to put my foot down because he's very hard-headed, but I want him here, and I want him in my life, and, he means the world to me. He helped me in our almost 25 years. He has helped me a lot with everything, and life gives you, it throws at you. We talk, we don't fight. We have little arguments of, we've never cursed at each other. We've never had a fight. I was previously married to. Well, very little fights. Very little. Very, and nothing violent.
I can tell you who wins.
Yeah, but our life is it's to us is precious, and we want to be here for our children, You know, I'm the stepmom, so I've never had.
Blended mom.
Bonus mom, the bonus
Blended mom,
mom.
blended mom,
Bonus
bonus mom, yeah.
That's right. What advice do you have for couples who are watching who maybe aren't talking about their health with each other? They're afraid to share, and or they're not asking, and nobody's talking about what's going on in health. Nobody asked mom and dad and nana and going back in the family tree. What advice do you have for couples?
I offer advice to my daughters, my stepdaughters, all my nieces and my nephews, all the young ones, even my sisters, and my advice to them is to be open and talk, because that's the way we've always been, honest with each other. And since day one, we laid the cards on the table and we told each other the truth. We both went through, bad things in life, with previous marriages, I didn't want to have that happen again. And then, so, that was the first thing that we did. We wrote it out. We made a 10-year plan at first, when we first met. And when we decided, that we were going to be together after a year.
Yeah.
A year. Yeah, about a year and a half.
We created like a vision, verbal vision board.
Yeah. And
Yeah.
I hadn't met his daughters yet. But I never had children. So communication is a big key. Maya was 15 and Martina
15.
was 14.
14,
Yeah, high school and junior high school. And I started raising them since then. And when I met them, it was love at first sight. I'm not atypical. They don't call me mom because I said, you have a mom. That's your mom. My name is Grace. You can call me mom if you want to, but they call me Grace. And I treat them like they were my own. That was a gift that David gave me, and I see it.
Grace equals mom, mom equals grace.
Right.
Right.
But to answer,
you caught that. It's in the name in itself.
Oh.
but to further answer your inquiry, Dr. Mo, about how to communicate. One of the things that I've seen with my friends and co-workers and so on is to really create a space for your partner to be able to say what needs to be said. Because I get so busy with work and everything else, and sometimes I'm not really paying attention. But when it comes to health, given that it's such an intimate conversation, turn off the cell phone, turn off the TV, all the background noise. If you're going to speak about, whatever you're trying to address health-wise, I think partners should. 7 minutes is better than 70 hours of talking about it, but 7 minutes of complete, they're paying attention to each other, and there's no other distractions to really hear, are you afraid of dying? Or how are you afraid? Or what's really happening? What's going on with you? Because that's extremely helpful. And I had to learn that over time, not just address, okay, you have this cancer, but how is it affecting you emotionally, mentally? What are you thinking about for the future? And to create a space where that conversation can actually take place.
Well, I had a question. When did you start your meditation program?
Oh, that was a long time ago. Long time ago.
Well,
I say in terms of program, I would say back in like 2003, 2004.
And how does it fit in relationship to cancer? Your cancer, your wife's cancer, how you were able to manage the stress?
Mm-hmm.
Well, that was one of my my head softening the skill sets, because through the meditation, I was able to really see myself more clearly. What warts and all, like, what's good, what's not working, what needs to, where I can improve. And, of course, the areas where I need to improve,
A lot of communication.
yes, communication.
Mhm.
And then over time, I started to recognize, well, the more I take time to actually meditate and slow down and connect, with myself, I'm able to be there for other people and to listen more than speak. That was the biggest thing I've learned in meditation. So, yeah.
But
God gave us 2 ears and 1 mouth.
Yeah.
For a reason, right?
But also very interesting is there the relationship between stress and cancer.
Mm-hmm.
Yes.
Yep.
See, I wanted to flag that it wasn't separate. Your survivorship, your journey forward incorporated not only the fact that you had a cancer, but at the same time you modified,
Right.
developed this whole different program of how to manage stress, which I don't know if you recognize how intertwined having cancer in the family and how managing stress helped you deal with the cancer, both of you moving forward.
Right. Right. Growing up, I wasn't exposed to any type of alternative methods. Actually, correction. There was only one person who would introduce that to me, and that was my sister. So she would talk about different types of meditation and so on, and different metaphysical ways to approach life. But then, she passed away 2004. Dad had passed away. Mom passed away. Brother passed away. So I'm left by myself to, there's no one to, kind of shoot the breeze with who's my blood relative. And meditation became, it went from the background to the forefront, and it became like a kind of have to, like, this is what I do at 5 a.m. And even if I go back to sleep, but at least for 20 minutes to 45 minutes, I got to sit still and do this.
That's powerful.
You know,
And
you guys,
others.
you know,
You
you guys-
teach others to do meditation?
What's that?
You teach others to do meditation as well?
Yes, I do.
That's great. I was saying, you guys got ill, very young and had to come together. And your love for each other is so precious and wonderful. I see so many couples that don't have to deal with illness till later in their marriages, and they don't really do too well with it. And maybe because they don't have, I think that I'm wondering, did your illness make your bond stronger, make your marriage stronger? Because you were so young when you were sick. I see older couples that they get sick and I'm not saying
absolutely, yes, because we got affected in the same area.
In the same week.
Yes, and in the same area down there, so a lot of things changed, and communication is the key. If you don't talk about things, I was kind of feeling a little lonely, and I did, communicate that to David, but the way I feel about him and having him in my life supersedes anything else. I said to him, we had our fun.
Functionality is not really present with me right now.
And that's one thing that we learned, that a lot of men and women have misconception about, that if they don't have that, they're not complete, and that is not true.
Mm-hmm.
It's not true.
So that the meditation has opened up so many doors,
right?
How to experience each other's energies,
Mm-hmm.
Right. Oh yes.
And we're like two peas in a pod. You know, if I'm thinking about him, he'll call me and vice versa. It's a lot of things that we have in common. Now, even our medications, you know, it's come to that, you know, so he gets stressed out, you know, and he gets his, you know, radiation cystitis problem come up. And, you know, I get stressed out. I get anxiety behind it. I go and do meditation to calm myself down and give him space. And that takes like an hour, you know, and it's come up quite a lot since the COVID, you know, and then dealing with the COVID and being home. You know, I've been working since I was 15 years old, and it's a big change, you know, that I had to, you know, lose my job. You know, I could have kept working even though I'm 62, you know, but a lot of things changed, you know, that I had to deal with. And I found that meditation and us being together, you know, and we were able to talk more about everything. Everything, you know, became, you know, the girls left a little while ago, you know, so we've been alone for quite a while. And so, you know, when the COVID hit and we were, you know, here by ourselves, you know, you hear stories, you know, a lot of bad things have happened or whatever. And it just made us even closer.
Right. Where I've heard a lot, you know, from friends, the pandemic actually, you know, pushed people apart, and they couldn't even be in the same household because of so many years of not communicating and not really being connected and just being, you know, perfunctory or functional. And then here comes a pandemic. You got two, you know, this married couple in a space where they don't know each other. You know, and so the best thing to do is like, well, as soon as the pandemic is when it lightens up, okay, here comes divorce court. So you see a lot of divorce lawyers, you know, extremely well, they're very busy right now. Yeah.
We've had a 20 to 25% increase in divorce rates as a result of the quarantining and the social distancing and you know, sort of the
can't
shelter.
Seeing each other every day, you know.
Right.
You know, but because
so what's something new you learned about each other?
Right.
What's something new?
Yeah.
Something new you've learned about each other in the last year.
Oh, we can be in the house together and not talk to each other at all. There have been days where we'll just say good morning, you know, or good night, you know, and because he's busy, you know, working or doing meditations, which he does twice a week, you know, and I'll be doing my thing, you know, walking the dog or going to the doctor or something, you know. But yeah.
One of the things that I've learned is from a electronic standpoint, I don't have much patience. It's like click, what's the buttons, get it done. I learned this process, don't change the process. But with Grace, even if a process changed, has been altered or something, she will, I really didn't recognize this, but she will stay there and figure things out and just keep trying and rebooting the computer, turning it back on, or figuring out the steps to get somewhere. So I have this full confidence that she's the tech head, that she's the one. You know, like if I can't figure something out, leave it to her, and within 25
because
minutes
I do a
to
lot
an
of
hour.
research. YouTube shows you a lot of things.
Look, YouTube. Look,
They teach you everything from A to Z, you know, and so, you know, I'm not a tech person at all.
Oh, yes, she is.
Yes,
she is.
The moment she said she's looking at YouTube trying to fix it, she got a little tool belt on, talking about, I got this. Go to bed.
I always wanted to work with computers, you know, when I first started working, and my first real job was in a bank, and I was offered a job, to babysit computers, IBM's. At the time, I was a data entry operator in the 80s. And I just didn't have that. They offered it to me and I could not take it. When I was in an abusive, relationship for a very long time, and I lost that opportunity. But that bug was always in my head. And when I learned about, the computers, I naturally I got one, and I do a lot of research. I read a lot, a lot of things you can't believe, when you Google things, but my life experience, tells me what is common sense,
It takes patience. It's
Yeah.
patience.
and it's patience. And I don't like to give up.
And
When
takes
I
grace
don't know
too.
something,
Yeah.
I don't give up at all.
That's
Nope.
I keep
She
going
doesn't.
until I figure it out.
Mhm.
So this gives me so
Wow.
much hope. This is
I
just
know.
delightful.
Mhm.
Oh,
I know you guys are like such a blessing,
Oh, thank you.
Thank you so much.
such a blessing. And I wish you health and happiness. And, I love how you take care of each other. And we need to bottle that up and sell it.
You as well.
Because I'm trying to tell you, when I saw your picture on the photo, when I came on, I had to tell you.
Right, right.
You exude this love and energy. I hadn't even met you,
Yeah.
but that's what you picked up from
This is
just
what love is. This is
Yeah.
what love is.
was
Yeah,
coming just from the flyer.
and I get that. We get that a lot. I'm the oldest of 4 girls. I'm 62, and from young, I never had any children, but my sisters did, and they were always in my house, and they stay over, and they love to be with their auntie, because I'm fun. I know that I'm fun, and I love them. I never had children of my own, and my future gave me children, and my nieces and my nephews, they're all mine, and everybody comes here, and everyone who meets us wants to just stay with us. I love to give advice,
'Cause you're full of grace.
and listen.
I'm lucky. I'm lucky.
Yeah.
Lucky, that's it.
Well, David, how can people participate in this meditation? How can folks who
Yeah.
might be watching and want to learn how to meditate and get some of what you got, man? How can they do
Oh,
it?
okay. Well, I do it every Sunday, like an introductory class on Sundays at 6 p.m. And it goes for an hour, and I take them through the process of breathing and relaxing and whatever. And so some people come back for the next week or the subsequent weeks, and then some don't. But I just do it out of a way to share what I've learned over the years as to how to take care of yourself, physically, emotionally, mentally, like my experience of doing that, and adding meditation to that to create more what is called efficacy or effectiveness.
Mhm.
Yeah, in your well-being.
Is
So
that-
every Sunday, 6 p.m., if somebody wants to participate, they could just email me at burtonimages@gmail.com.
You got that, Mo? Putting in the
Got
chat.
it, putting it in the
Okay.
comments.
All right. Cool.
BurtonImages@gmail.com.
That's correct.
Great.
Wow.
Great.
So if and there's a lot that we're taking in today, and see, this is, I consider all of the Doctor's In's classes, sessions are extremely powerful. But this is a very powerful and experience today, and how important. We've covered so many different topics, from genetics to meditation and
Clinical trials.
and clinical trials.
Yeah, I'm interested.
And it's almost like COVID, cancer, and courtship.
And this is our Valentine's Day party.
Hey, this is
right?
like the Valentine's.
Right.
This is our first
Love,
Valentine's Day
I don't know about
discussion.
y'all, but I feel a deep and enduring love, you know?
Right.
That's what I said. It's just
I want some of that.
I said,
right?
that's what I'm saying. I said like, shoot, I said like, can you bottle that? Who said that earlier? Bottle that bad boy up. I'm like, I'm getting some Grace and David tonight.
Light it.
Right. So Dr. Keith, tell people how to find you at Penn and all the good stuff you're doing for
Yes.
prostate cancer.
So, David, I wanted to ask you before we go, what message would you give to prostate cancer men?
Get all the information.
Yep, get your information, get it early, and also one of the to not be afraid of loss and your functionality. To not be afraid. There's a greater power that comes out when that part of us is impacted. It can't be described in words, but if you're not afraid, and you just keep afraid, but just keep pushing, find out ways to heal, but to just keep finding out more information, and to not be afraid that if you can't function, you may not be able to function there, but other abilities are going to emerge.
So Black men or men in general feel a loss of masculinity?
Yes. And it's crushing. It's completely crushing when you know that the part of you that gives you swagger and whatever, you the man, when that gets impacted, some people can't handle it, and then it's drugs or booze or whatever, but there's something greater that emerges from. It's like if you lose your hearing, then your sight gets stronger. If you lose your ability to speak, your ability to think or write, it increases. If you can't do certain things that are constantly being promoted on the media about your prowess, what else is there to deliver to the world? But what comes up is something that is so intimate, so private. And if you continue to explore that, there's a lot of power to it. Yeah, that's how I explain it.
I said, okay, because I think that, what we're saying is that Finn, founded by a survivor who'll be 21-year survivor. So I'm letting you know right now. So radiation treatment, but he's a 21-year survivor. So I'm open the door for you to see that someone who's had prostate cancer, high risk,
right,
is a 21-year survivor. But I'm going to tell you something else. We have men 40 diagnosed when they're 47, a year after you, 74 years old.
Wow.
Participated in 4 clinical trials. All they did was hit the puck down the ice. So I want you to envision that.
Right.
So that there's not a wall. The door, I want you to open that door. I want you to see.
Got it. Okay.
You see?
Got it. I hear you.
And then what I'll do is I really like the interchange and the energy, and would like more people to hear about your meditation on Sunday. So even being able to write a story that we should share, because what's important is that at Finn, we recognize it's not men by themselves. That's why this episode was so important to me and so important for us, is because there's always the wife, the girlfriend, the mother, the caregiver who's telling you what to do, making that head.
Right. That's right. That's right. That's right.
That's right. And so, and so even when, if you look at how we approach it, we have something called Daddy's Boys, which is a play that we used to be a stage
Great. It's
that
really great.
traveled,
You
but
should
now
do
it's like a mini series that we have an episode coming up. But the point is, if you look at the ratings, you have 40%, 50% women and men. So it's almost,
That's a good balance.
it's a good balance, but we always have our loved ones who are supporting us. And this is why this was so important for us and for men on this end, is because now also to acknowledge the fact that a lot of women out there are fighting breast cancer by ourselves. So we don't want to forget our sisters out there.
Right.
Okay. And I know that my sisters, Dr. Mo and Ricky, are out there supporting those women and covering them. But it's important that the men who listen and that we can share this with can also start checking in with their support structure and making sure that they're not like you said before, where loss of masculinity. Sometimes Black women need to take off the cape. Sometimes women of color need to take off the cape. They don't have to be super women all the time.
Right.
Well, you know what, Dr. Keith, our next week episode is superhero Superman. And so we have three husbands who were nominated by their wives for how they have helped them through the breast cancer experience. So that's a good segue. We're going next week. So we're going to continue the love story.
Because
great.
Hey, this is the Valentine's Day month.
Yeah, there we go.
Love month, love month.
And what's so amazing about this, this program is so special because there's nothing like this in the world. Nothing. You would not have heard this sequence today. This is how special it is, and a lot of people may not know, but this is what we do. And I'm just.
Well, if I could, I'd like to give a shout out to Nancy Horard, because she was the one who said, "Hey, David, I know, about your history with, between you and Grace and your health. There's a program," and she just, in a very short, concise way, explained what it was. I was like, okay, but I respect and know Nancy for a long time. So I said, fine. And then I reached out to Ricky, and Ricky was like completely clear, totally clear on what was it about, what was the experience, what would be the possible experience. And also, I told Ricky, I said, well, Grace doesn't like to, talk too much. But as you see, that I was wrong. I was wrong.
That is not true, dude. That is
not true.
I guess you didn't learn that at home.
Well, no, I don't talk to everyone because I have to have I'm better one-on-one. This thing that we have now that we could talk to each other, with this, it's a whole new experience because you could get to communicate with so many people and get to heal that. I'm kind of an introvert, and I like one-on-one. Right. I'm not good with a big crowd because I become blank. Like, I don't know. Everything goes away. I don't know what to say. Everything becomes a blank piece of paper. But one-on-one, I can feel the energy. I can look into your eyes, and it was very comfortable talking to you guys. Very, very comfortable. Yeah. And the energy that you exude made me feel, like I don't have to not hide, but just, because I bottle in a lot of things, and to talk. about things that I'm experiencing, which I don't usually do. I
You
just
just made a commercial for us. You just made a commercial.
Because
Dave knows everything, you know.
Yeah,
I don't
well,
talk to a lot of
yes,
people, you know.
sure.
Grace, you are one-on-one and heart-to-heart with thousands of people right now.
Right.
Oh, thank you.
Right.
Are saying what they need to hear. You're telling the stories that people can identify with as they've gone through their cancer journey, as they watch their loved ones go through this journey, the things you know, the things you don't know, and your transparency and your honesty and your discussion and your vulnerability is a blessing to so many people, because this is what folks don't get. You know, sometimes they'll go to the support groups and things, and we're not always able to share these things, and they don't always look like us in these support groups, in these spaces. And so you are providing an opportunity for people all around the world. Folks around the world are watching in Senegal, and I mean every continent. You name it. People are listening. and
Oh,
saying,
here now.
no, not at all.
Already did.
I said, but
That's
the
amazing.
point is that you are a role model
You
for
have a-
relationship,
You
cancer
are a
relationship.
role model. You are a perfect role model, and we so appreciate you.
Thank
So
you so
appreciate
much. That means a lot to us. Yes.
Thank you, Nancy, for that.
You gotta come back
so
again.
much.
You gotta come back again.
Yes,
Sure,
definitely.
sure. Please
Matter,
pay.
Absolutely.
matter of fact, I may call you because I'm having a problem with my computer.
Grace, I think you just got a side hustle out of this.
I
show.
said, yeah,
And,
I've been
and
trying
David,
to.
David, if you want to put your meditation session on our Facebook page, on our Touch Facebook page, we would love to do that anytime. So
Oh, okay,
just
sure.
I'd love him to lead it.
put our-
through.
put
Oh, that'd
it
be
on our
great.
Facebook page, that would be great.
Wonderful. Yes.
We'd love to have you on our Touch Facebook page. So anytime.
Well,
Okay.
you know, every Wednesday we set out to make this show that has been ever since COVID started last March. I think we started in March, didn't we, Ricky?
We started in April, Mo. Can you believe
April.
that?
In April, you know, to do something that's relatable and reliable and real. And
Yeah.
that's our tagline:
Yeah.
relatable, reliable, and real. You know, the doctor
This
said,
thing that happened that emerged in COVID, that you can be in your home and talk to everyone like this, that's amazing to me.
Yeah. Well,
You
we're
know,
trying to do it every week. So come
That's
back
amazing.
and yeah. And Dr. Keith, we'll put your info in the chat, but you know, they can
Yep.
reach out to you at Prostate Health Education Network, Ben, and you know how to reach me, you know, Touch BBCA.
Right.
And then you can give them my number, which is 202-538-3336. And if they need to call.
wow.
That's
Call
what
us,
we're here for.
tweet us, text us. You know we got you. We got you.
538
202-538-3336.
3336. Doctor, thank you so much. You know, you're not a guest, you're family.
I know.
Every time you come on our show.
I'm
Yeah.
telling you. I said
That is correct, family.
Yeah.
You know, you don't know how much it means to us to have done this, and you're in my heart, and that's where you will stay always.
Oh, thank you.
Well, I can,
You're
the truth
good
I can
luck.
Thank
say,
you so much.
I said
Thank
that,
you so much.
that, like I said, it started out with your image. I'm just letting you know. I called, I said, like, I said, this is a beautiful couple. And I'm like, and I had to tell before you even got on the phone, I got on the Zoom. I told David, I said, like, David, can I just say something? I said, I'm kind of country, but still,
That's all right. All right. Thank you.
All right, you
Thank
guys. The doctor is in. Here's some breasty love. We'll
Yeah,
see you
thank
next week for some more love.
Oh, great. Thank you.
Care.
Oh,
Bye
Grace,
bye.
I'll
getting
be
better.
dinner soon as COVID is through, because you're only one state and 2 hours away. So
All right, we're coming for dinner. Yeah.
Okay, good.
Yes.
Yeah,
All right.
we're coming for
Yes.
dinner.
All right.
Bye
I'm
bye.
gonna hold you to that. So
All right.
I'll cook a nice dinner.
I'm sure.
Yes.
we'll see you all next
night.
Wednesday
All
night.
right,
6
next week.
p.m. The doctor is in.
Doctor is in.
Righty.
thank you.
Good night.
Good
Thank
night.
you. Night.
Good night.
Good night.